We always talk about testosterone as the GSD hormone. It's one of my favorite hormones. And, I tout the importance, whether you're male or female. But today we're specifically talking about testosterone levels for females. Now, I'll give you guys some love too, so don't just completely tune out. But we are going to be deep diving into testosterone and females and how it affects your thyroid. And I bet there's going to be some nuggets in here that you did not know. I can promise you that. So testosterone, GSD, it is your get shit done hormone. It gives you motivation. It gives you energy. It gives you the ability to build lean, sexy muscle at the gym. It gives you the ability to burn fat. But here's the other thing that it does, and this might blow your mind a little bit. It actually protects against autoimmune. So let's break this down. We know that Hashimoto's affects more women than men. So most of you listening, if we took a poll right now at this moment, 95% of you are going to be women. 5% are going to be men. And I do have male patients with Hashimoto's, hypothyroidism. I do. But most of you are women because our hormones are all over the place. We have high estrogen. We have testosterone, and oftentimes it's low. That's what we're going to talk about today. But that low testosterone, did you know that low testosterone can actually turn on that autoimmune switch? So when we're talking about Hashimoto's, normally I talk about there being a stressor. So pregnancy. Many women experience the onset of Hashimoto's after pregnancy. They'll say, after my second kid, all went to hell after that. And that's when I was diagnosed with Hashimoto's. It can be after a death, a divorce, any kind of major stressor. That high cortisol level can turn on Hashimoto's. But here's the thing, low testosterone is a stressor on your body because testosterone is very protective of the immune system. So we see more cases of autoimmune affect women because in general, we just have lower testosterone levels anyways, as compared to a male. But with Hashimoto's, we often see low testosterone. As we age, we see low testosterone. So I want to break that down and actually kind of teach you the importance of having optimal testosterone levels and what you can do. So what we know about any kind of autoimmune condition, including Hashimoto thyroiditis, is that the immune system is confused. So like I always say, I always use the analogy of soldiers. You got these soldiers that think that your thyroid gland is an invader. And they like to mount up and go out and start attacking your thyroid gland. And that's why there are stages of Hashimoto's where we will see that thyroid gland slowly be destroyed. And as it's being destroyed, it's not producing the right amounts of T4 and T3 anymore. And that's why you get symptoms. Testosterone, which is a hormone, a sex hormone, is very protective. Again, it can actually improve your immune system and it can calm down that autoimmune attack. So it can tell your soldiers, listen, I know you're there and I know you want to beat up the thyroid. I know you think that it's an invader, but why don't you just chill out in your barracks, have some beer, watch some TV, chill out. You don't need to go out and attack the thyroid gland. Now, testosterone comes in and it helps that. It starts to talk to the soldiers and it's like, listen, especially when you have enough testosterone. Like, listen, guys, today is not the day to start a war. Today is the day to just chill. Leave the thyroid alone. The person isn't even eating gluten, so just leave it alone. And it mounts up your immune system to actually be protective against an autoimmune attack. Now, let's say you don't even know if you have Hashimoto's or not. Well, guess what? Having proper amounts of testosterone can help prevent that switch. So you say, okay, wait, my mom and my grandma and my aunt and my sister all have autoimmune and 3 of them have Hashimoto's. well, you're pretty much next in line. But what can you do to prevent that? Keep your immune system strong and make sure your testosterone levels are optimal. Okay, so now the next question obviously is going to be, how do I know? And what are those optimal levels? If you get free and total testosterone done, so there are 2 tests that you have to ask for. Don't go in and ask for a full thyroid or a full hormone panel, because most of the time, if you're a woman, your doctor is going to test estrogen because they think for some odd reason that that's the only hormone that you have. And then you'll get follicle stimulating hormone and luteinizing hormone. They'll throw those in. I know because this happened to me. So believe me, and this happened recently to me. This was just my PCP, but I know who I can go to get a full panel. But I was in, oh gosh, actually, this was probably like a year or 2 ago. I was in just for, routine, blah, blah, blah. I have to get it on the books. And I said, I just want a full hormone panel done. I didn't want to pay for it myself. Let's run it through insurance. And I walked out with a script, the lab script, and it had estrogen, LH, FSH. I threw it in the trash. So since then, I have gotten mine full hormone panel done, but you got to be specific. So you have to say, I want estrogen, progesterone, free and total testosterone, and DHEA. Now, when we're looking at free and total testosterone, I like to look at the total. Now, the free, obviously, when we're talking thyroid, the free is always better because that is free, bioavailable, ready to be taken up by your cells. But with testosterone, I mean, I like to look at the free, absolutely, but I really love looking at that total because that just gives us that instant snapshot. Boom, right there. And the bottom line is, if your testosterone, your total testosterone as a male or female is coming in low, then the free is going to be low as well. So when I look at that total testosterone for a woman, I really like it to be. Now, I've changed my stance a little bit on this. I've actually gone higher. I used to say 40 and above. Then I interviewed Dr. Anthony J, and he's like, oh, I like my females at 50 or above. I was like, oh, dude, you might be onto something there. Because most of the women that I talk to that are patients of mine who, let's say they come and we're working together one-on-one, and they've already gone through the gamut. They're on pellets, which I'm not a fan of, or they're on injectables, which I am a fan of. And we'll test their testosterone and their total will be 100, 120. They're like, don't you dare lower my testosterone. This is where I feel my best. Now, if you feel great at a higher level of testosterone and you don't have androgenic side effects, meaning you are not getting abnormal amounts of facial hair, you're not growing a beard, and you don't have acne like a 14-year-old boy, then okay, let's ride that higher testosterone. That's fine, because that's going to be very protective. It's going to help you build muscle. It's going to help you burn fat. It's going to give you a libido, because how many of you ladies say you just don't want it anymore? You got no libido left, no drive, not even the feeling of like, hey, honey, let's go in the bedroom. Nothing is happening. Now, vaginal dryness is estrogen. Low libido is testosterone. So I digress. Back to the total. 40, 50, or above. Can I tell you the amount of women that I see coming in at a 5, 13, 19, 25? I mean, literally all the way up to that 40-ish. I would accept 40 if someone's like, yeah, I'm a rock star. I feel awesome. Otherwise, let's push it to 50. Let's get you to 50. I don't care if the standard lab value cuts you off at 41 and then you're flagged high at a 45, at a 49, at a 50, at a 55. I don't care. I want you 40 to 50 or above. Or, like we say with the thyroid, in that upper, and I'm not even going to say quadrant. I mean, you better be up in that 10%, the upper 10%. of the standard lab value range or over. Because I know some labs will cut a woman off at 30. Some labs will cut a woman off at 50. So you better be in that upper little nook or you better be over. Because preferably I'd like you to see you right at that upper limit or over, because that's where you're going to feel your best. So 40, 50 or above or over, as long as you are not experiencing androgenic side effects. Now, I have seen also patients with absolutely no testosterone. There are a couple of you, and you know who you are because I told you you won a prize, who are literally like, there's no testosterone at all. It's not even registering on the labs. It says less than 3. It can't even register the amount of testosterone in your body. And let me just tell you, if you are there, maybe you're not even my patient, but you're sitting there with your labs right now and you're going, oh my God, I have no testosterone. You need to grab some patience. Patience, patience. You need to grab hold of some patience, because when you have no sex hormones whatsoever, it is going to be a long, long journey to build up your metabolism. It can be done. It absolutely can be done. And as we optimize your thyroid, that has a trickle-down effect on your sex hormones. But when testosterone is in the shitter, your metabolism is right there with it. And it is going to take a while to come back up and to light that fire, to give you that ability to burn fat, to build muscle, which muscle is metabolically active. Muscle helps you burn more fat. So the more muscle you have, and I'm not talking about looking like a bodybuilder. I'm not talking about looking like a dude when you're a woman. I'm talking about that lean, sexy muscle that when you go to the gym and you lift heavy weights, you actually start to get some shape coming back. You have strength. You move from those 5-pound weights to the 15-pound to the 20-pound, and you get stronger and you feel stronger and you feel better, and your spine is protected and your bones are protected, and you are burning more fat at rest. That's the muscle that I'm talking about. That lean, sexy muscle look. Unless you have proper levels of testosterone, you're not going to have that. So if you are in the basement with testosterone, then you have to be patient as you build that up. And I know it's hard. I know it's hard. I have a patient right now that we just talked yesterday or the day before. And she's so frustrated because she's not losing weight, but she has 0 hormones. Yes, we're working on her thyroid. We're building up that T3 level. It's awesome. But looking at her profile, it really reminded me and gave me the inspiration for this today, because with testosterone at less than 3 and no estrogen and no progesterone, that's another podcast entirely, but without sex hormones, you have no metabolism. We have to build that up as well. We have to. So when we are talking about the use of testosterone, there are a variety of different ways to do this. So we're going to break that down. Now, number one, testosterone is usually prescribed. There are supplements that we can use, so we'll get to that. Testosterone is usually prescribed, and I had mentioned pellets earlier. Here's why I don't like pellets. I hope every patient and every future patient of mine listens to this, because this is why I don't like pellets. They release an absurd amount of hormone upon insertion. And if you've had pellets, you're going to be nodding. You're going to be going, yeah, I get what you're saying. And we will get testosterone levels on women of 200 after a pellet. So after they insert the pellet, they put it in your bum, under your skin, and it releases hormones. So we put in a testosterone pellet. A woman can get a test level of 200 or more that first month. So you get that big surge. And I got to say, a lot of times you will feel good. You will feel good because we're giving you a crap ton of testosterone all at once. You get that energy back. You get your mood back, which, by the way, let me sidestep. Testosterone is imperative for mood. Ask a man with low T. Because you ladies, you tend to jumble everything. You think, oh my God, I need more thyroid medication. And maybe I'm estrogen dominant. Maybe you are, maybe you do. But if your testosterone's in the basement, your mood will be there as well, along with your metabolism. So it'll be testosterone, metabolism, and your mood all in the basement together, having a party. They're all talking to each other, being like, yeah, dude, you hanging out down here? Yeah, I am. When you coming up out of the basement? I don't know. As soon as she starts replacing the hormones that aren't being made by our body, then we'll come up out of the basement. Your mood is going to be there as well. So ask a man with low T. He will tell you total apathy. Doesn't care about anything. No motivation. Kind of borderline depression, but definitely no motivation to work out, no motivation to work, no motivation to do the laundry or help you out around the house. No sex drive. He doesn't feel like a man anymore. We'll take a woman with low testosterone. You are going to be very apathetic, more than likely depressed. And then if you add low progesterone on top of that, you're going to be depressed and irritated and agitated and annoyed and anxious all at the same time as well. So it affects mood. So pellets, I know I keep diverting. Pellets, it gives you that surge where you feel really, really good. And then you might start getting some androgenic side effects. You might start seeing a little bit of facial hair, some breaking out. Now, listen, as we get older, can we just talk on the side? Men, can you earmuff yourself? Because you don't want to hear this at all. You don't want to hear this at all. Ladies, as we get older, we tend to get the little dark hairs. I get it. You're plucking them. Maybe you go for the laser treatment, but you tend to get a few more dark hairs. That's just age. But also, if your testosterone level is too high via pellets, you might start growing a little bit of a beard. You might have to start looking into laser hair removal a little bit more seriously. And then you get acne. I mean, cystic acne. I mean, you start to look like a teenage boy. That's not good. Those are all the androgenic side effects of too high testosterone. Now, the anabolic side effects that we love, that's where you get the muscle building. That's where you get the fat loss. That's where you get all the positive effects. But that doesn't come with pellets until it starts coming down the other side. And you start to actually balance out at that 40, 50, 60, 70 mark, not 200. And then you start to go down, way down the other side with pellets, where now you're crashing and, oh, look, I still have a month or 2 months before I get my new pellet inserted. That's why I don't like pellets. Too erratic. Send you on a roller coaster. What do I like? I like creams. I like testosterone compounded creams. And I like injectables. Injectables usually about once a week. Now, when you start tuning into your body, you can tell, I'll give you myself as an example. You guys know all about me. You know I'm on T3 only. You know my dose. You know my symptoms. You know my story. I'm also on testosterone, by the way. Yes, I do have PCOS. Many of you know that. But PCOS is under control. I'm 48 years old. So it's really not affecting me like it did in my 20s and 30s. So I no longer have high testosterone levels that sometimes can go along with PCOS. I do have the insulin resistance that I always keep under control. And I keep that under control with berberine. So I digress. So yes, you could have too high of testosterone levels with PCOS. But for me, I take testosterone injectable. And I do it once a week, usually. So when you're in tune with your body and you're on injectable, let's say you're doing it once a week, and then you're like, oh man, I'm getting the cystic stuff down here on my chin. I'm getting a couple on my forehead, maybe a few more facial hairs than what we just talked about 5 minutes ago. And that's when you back off. So you back off, maybe stretch it to 10 days, maybe go 2 weeks with it. If you start to hold a little bit of water, because remember, testosterone can aromatize into estrogen. So when testosterone aromatizes into estrogen, that's why we give males an aromatase inhibitor so that they don't get high estrogen levels, because we don't want guys walking around with high E. So when we give guys an aromatase inhibitor, it blocks that. So with Females, we don't normally do that unless you tend to run high estrogen. Then we could use something like an aromatase inhibitor, DIM, calcium D-glucarate. But some of that may convert over. So when I start to get watery or poofy, then I back off and maybe I go every couple weeks instead. So really, you can tune into your body. I would say if you're really low, then do as your prescriber prescribes and go every 7 days to build that up. Now, last but not least, we can also use supplements. So hang on to your panties, depending on when you're listening to this. If you're listening to this as a replay, it might be out. But I am coming out with the Hormone Fixer supplement because, just like I said in the beginning, I am seeing hundreds of women like monthly. I mean, just, gosh, if I had to give a percentage, again, just like I say, 99% of hypothyroid patients have insulin resistance. I'm running with about 90 to 95% of my thyroid patients, male or female, have low testosterone, not optimal testosterone by any way, shape, or form. And it almost goes hand in hand with Hashimoto's because you have this interplay. You have testosterone being very protective of the immune system and against autoimmune. But then you have the thyroid gland not being optimized, which has a direct effect on your sex hormone levels. So if your thyroid isn't optimized, all of your hormones are going in the basement, including testosterone. So it's this kind of back and forth interplay with testosterone and thyroid. So yes, I have decided to come out with the Hormone Fixer supplement for women that will raise your testosterone naturally. So if you're sitting there looking at your test level and you're like, oh my God, I'm like a 15. I'm only 20. I'm only 25. Then yes, this is something that you can take. We'll have more information in the coming weeks. We're just a couple weeks away from you guys being able to get it. So hang tight. I promise you more information. The more, if you follow me on Facebook, if you follow me on Instagram, if you're on my email list, if you've downloaded one of my guides, if you're in my private Facebook group, which is Dr. Amie Hornaman, the Thyroid Fixer, Love Your Mirror, because I want you to love your mirror. Testosterone's part of that. So if you're in that group, you're definitely going to be the first to see the announcements on my 3 supplements that are coming out. But one of them, I'll tell you more about them later. One of them is the Hormone Fixer. So that is specifically targeted to raising a female's testosterone level. And I know you're saying, okay, well, my doctor told me to take DHEA. That's fine. If I'm looking at your DHEA, and then this has a little bit of DHEA in it, but you don't just want to use that. You don't just want to use DHEA. You want to use a blend that's going to target your actual testosterone levels, not just DHEA. That is a precursor, but again, it's like giving you T4 and crossing our fingers and wishing on a rainbow that it converts over to T3. So DHEA is the same thing. It does not have that direct effect that testosterone does. So DHEA has to convert over to testosterone. It's also supportive of the adrenal, so it's not bad to take. But again, it's the kind of long way around. It's the very, very long journey. Whereas directly impacting testosterone with a prescription cream, a prescription injectable, or using a supplement is the direct way to go so that we can get that testosterone up into its optimal range. That will help your thyroid. It will help with autoimmune. It will help with all of your symptoms. I promise you that. I've seen it over and over and over again. It is a game changer. And women, I'm circling back to the sex drive again. Listen, if you have low sex drive, and I've talked about this. I was a guest on Thyroid Nation. Unfortunately, that podcast is no longer in existence. But when I was on there, myself and the ladies talked directly about low libido. And I say this all the time. Listen, sometimes, and we have another podcast on this called Let's Talk About Sex, Baby. Sometimes it's about participation. Sometimes it's about us not feeling all that great about how we look. So if you're dealing with a thyroid problem and you have that extra weight and you're losing your hair and you feel poofy, you're not going to be in the mood. There's no amount of testosterone that we can pump into you to make you magically have a sex drive. So of course we want to get your confidence back, but testosterone is a way to do that because we're going to build that lean, sexy muscle and we're going to give you more ability to burn fat. And it's going to help with your sex drive, kind of bump that up a little bit. So as you're feeling more sexy, as you're feeling more confident, as you're feeling better about yourself, as the stress of your health condition is starting to go down because you're actually getting optimized for once in your life, you see some hope, you see the light at the end of the tunnel, hopefully, if you're working with somebody knowledgeable, aka me or somebody else knowledgeable, then you start to see that light at the end of the tunnel and you're like, you know what? I'm feeling better. I'm putting on clothes that are fitting a little bit better. That jacket that I haven't worn in 3 years, yeah, it fits well now. Now I can zip it. I don't have to pull it and stretch it to try to zip it. So as you feel better, obviously your sex drive and your confidence are going to go up. And that's my ultimate goal. Ultimate goal. So low testosterone, huge contributor to weight loss resistance with women and men, but mainly we're talking women today with Hashimoto's and hypothyroidism. So I always talk about that double whammy with insulin resistance and low thyroid. We could probably add a double/triple whammy with low testosterone. So you low testosterone and Hashimoto's hypothyroidism, then you have a double whammy to weight loss. Nothing's going to happen. Nothing. Then if you have low testosterone and insulin resistance and Hashimoto's or hypothyroidism, however you want to classify it, then you have a triple whammy to weight loss. It is not going to happen until you address all factors. When you address the testosterone factor, you're addressing a big piece of the puzzle. If I had to say the importance, that'd be, man, that's really like holding my feet to the fire. Thyroid always, master gland, that's number one. Oh, insulin and testosterone, they're close. They're in a close race. If you have insulin resistance, that's going to raise your reverse T3. So maybe insulin number 2, thyroid or testosterone number 3, but they're really darn close as factors to address in order to have a metabolism. Any kind of metabolism, energy, weight loss, fat loss, muscle building, feeling good, great mood, reducing irritability, all of it. So there is the importance of testosterone. I hope you learned a little bit today because this is some good stuff. Good stuff. And like I said, make sure you connect with me somehow so that you can be the first when we finally launch these supplements. Thank you, supply chain issues. It's been forever. I'm super excited. You guys helped design the labels. So you want to actually see the supplements, don't you? Yes, the Hormone Fixer supplement directly affects testosterone levels. And we will be talking more about the blood sugar fixer. You know is going to be berberine, higher dose of berberine too. So it's going to save you some money. And then the thyroid fixer. Oh, that one. I'm just going to leave you hanging. It's unique. It is proprietary. It is going to rock your world. So just hang tight. I know I just gave you a little taste and now you're like, what is it? Hang in there, follow me. And I promise you'll be the first to hear. All right. I want to get to some questions that are popping in here. All right. Emma, 50 or above. I had a 47. I was told I was high and had suspected PCOS. Ooh, great question, Emma. So, like I said, you have that standard lab value range, right? So with PCOS, polycystic ovarian syndrome, for those of you who don't know, there are different diagnostic criteria, and they're actually changing the diagnostic criteria for PCOS now. They're actually thinking about not calling it polycystic ovarian syndrome because you actually don't even have to have cysts on your ovaries to be diagnosed with PCOS. You do have to have high insulin. So high insulin is one big factor. I always say I like insulin levels below a 6. So if you have high insulin, that's a factor. Irregular cycles, missed periods, infertility, miscarriages. Sometimes we'll see low progesterone with PCOS. Sometimes we'll see estrogen dominance with PCOS, and testosterone can be high or low. So, Emma, I have PCOS. I never had high testosterone. That was never a factor. I broke out because of the high insulin. Insulin is very inflammatory. So I'll never forget when I went to my functional doctor that saved my life. I went in, and this was after we started optimizing my thyroid. I said, Doc, what's going on here? I was breaking out. I looked like a pizza. And I started gaining weight again. I'm like, hey, I'm gaining weight and I'm breaking out. What's going on? He looks at me and goes, you have PCOS. It's like, we can test for it, but you got PCOS. So we started addressing the insulin. I used metformin. Now I use metformin and berberine together because they work really well together. Never put me on birth control. God love them. And then I used progesterone. I used Vitex Chaseberry to bring up. I had the low progesterone, but I never had the high testosterone levels. And to really say that someone has high, quote unquote, testosterone, you can't. It's very individual. So just like I said, I have ladies that are like at 100, 120, 130, and they're like, don't you touch my testosterone level. I'm like, okay, as long as you feel good, we're good. So, Emma, I can't really say that 50 or 47 is high because in my book, it's optimal. It's all about how it pairs up with your other symptoms. So if you're super young, if you have missed periods, if you're infertile, you know what? I still wouldn't do anything to bring down the testosterone, but I would look and see, do you have low progesterone as well? Do you have a thyroid problem as well? Because then we have to fix those aspects to address the symptoms that you're dealing with. Kristen, primary doctor tested my testosterone. It was 8. Oh my God, that's low. He said he doesn't treat it for women to do so many risks. One moron. Gosh, you sure he's not an endo with that level of knowledge? Gynecologist said I am a good candidate for pellets. Endocrinologist said no. So we got a primary, we got a gyno, we got an endo. The primary and endo are out. The gynecologist is on point. You can try the pellets because at least that's one person that's trying to help you. But you heard me talk about them, so you can know what to expect. Or maybe if the gynecologist is open to doing so, now remember they get money off of the pellets too. So if your gynecologist is open to doing so, maybe ask for an injectable, because in that way you can better control it week after week after week, as opposed to doing the pellets and getting that big surge and then the deep drop off at the end. What if one has high testosterone with Hashi? This is Ivelisse. So that's a great question. Normally when we see high testosterone with Hashimoto's, it is PCOS. And it's PCOS with truly high testosterone. But Ivelisse, just like I answered Emma, is it high? Is it not high? Is it high because it's being flagged on a standard lab value range that cuts you off at 40 anyways? Or is it 150 and you're breaking out everywhere? So they're two different things. When you say high, you can't just say high. You got to come in with a number. Just like, okay, somebody's popping in as a Facebook user, not with a name. Is 80 too high? I don't know. Is it? Only you can answer that. There is no too high because, like I said, I have women in the hundreds and they love it and they feel good. And this is more than one person. This is not an N=1 experiment. This is multiple. So 80 might be optimal for you. If you have a testosterone of 80 and you're like, man, I am strong, I am lean, I have nice definition in my muscles, I have a sex drive, I feel great, then I wouldn't touch your testosterone. If your testosterone is an 80 and you're breaking out and you're growing a beard and you have no estrogen and you have no progesterone and your thyroid is a disaster, then maybe we have to address that. So it's all unique to that person. Let's see here. When's the best time to test testosterone? Nice question, Ivelisse. Doesn't matter. So with estrogen and progesterone, if you are a cycling woman still having a regular cycle, we like to test these 19 to 22. Testosterone doesn't matter. Now, granted, if you are testing all of your sex hormones, which you should be anyways, because you should look at that full picture, right? With estrogen and progesterone in relation. So if you're testing all of them, they're going to land at the same time anyway. So if you try to do 19 to 22 every time you test during your cycle, those days, every time you test, then it's going to be, you're going to have that same like apples to apples to apples to apples comparison of the same day. Okay. What about high DHEA? So again, we have to look at if someone has high DHEA but low testosterone, why? Again, that's like having super high T4 levels. Maybe we're pumping you full of T4, or maybe you're taking DHEA because you heard it was good for fat loss. You have super high T4 levels, but nobody's checking the reverse T3 and the free T3s in the basement. Well, that's great that you have high free T4 levels, but it's not converting. So that high DHEA, which I have seen high DHEA and low testosterone, then it's not converting. There's an issue somewhere along the way. That's when I really like to look at cortisol, because DHEA does play a role with cortisol as well. So I like to see what your adrenals are doing when you have high DHEA and low testosterone. Now, high DHEA with like moderate to optimal testosterone could, again, come back to PCOS, and it's all in the symptoms. It's all in the symptoms that you have. Jennifer, I got Hashimoto's right after having my fourth child. This is what we see a lot, right? That's what I said. And having a tubal ligation. I'm on testosterone. My antibodies went negative. But the antibodies that start with the P, you mean TPO, went from normal range to slightly high. Remember, we don't hang our hat on antibodies at all. They can fluctuate a little bit, but that has nothing to do with exactly how you're doing. My free varies from a 3 to a 7. Dr. Kathy Malpin says she doesn't check total. She only tests free because a lot of the total is bound by SHBG and other liver proteins. If you have high sex hormone binding globulin, high sex hormone binding globulin will bind to testosterone and it will bind to thyroid hormone. So if you have high SHBG, then that in testing that total hormone profile, that tells us a lot. We have to do things to lower it. But I still test the total. I mean, I will look at the free, but I still test the total because I want to see that full picture. Why would we ever, and this is for testosterone, why would we ever test just the free? Now, with thyroid hormones, we can test just the free. I don't necessarily need to look at your total. If it's there, I'll look at it. Okay. And you normally just confirms it. But with testosterone, I like looking at the total. Okay. Maureen, I need to schedule a consult. Should I get my doc to order new labs first, or do you order what I need after our consult? So, Maureen, if you become a patient, then we order it. No worries there. If you want to get them just to see what they are, but chances are we'll pull new labs anyways closer to your consultation. Okay, Lisa, what's the optimal level for T? 40 to 50 or above for that total. So really in the upper, like near the top of that range. So it depends on the lab. The lab is all over the labs are all over whether you go to Quest, LabCorp, or any lab test now, Alta, they're all over the place for the ranges for total testosterone, but really close to the top, if not even over, because it really correlates to how you're feeling as well. So just like thyroid, we have to ask those important words. How do you feel? Because that's going to tell me a lot about where your testosterone level is in relationship to your symptoms. So if you're telling me, listen, I'm working on my thyroid, getting optimized. Let's say your free T3 is like a 3.1, 3.2. And everything looks really good. And you're on T4 and T3, or we're working together and we're optimizing your thyroid. And we look at your testosterone and it's, let's say, a 15. That's too low for me. And you have lack of muscle tone. You can't build muscle even though you're lifting heavy in the gym. You can't burn fat no matter what. Those are all symptoms that are telling me, okay, you might need a little bit of a higher number, a higher level. And we definitely need to get you up into the optimal. And then from there, once you're optimal, then we go, okay, how do you feel? How do you feel? And those 4 important words are vital to properly treating. J-Ro says, hit that thumbs up button. Taking biohormones makes me gain weight. Why? Well, I would say, number one, it just all depends, again, with any kind of bioidentical hormones. And you bring up a good point, J-Ro love. You bring up a good point about bioidentical. There is a definitive difference. Now, when we're talking testosterone, it's with birth control, they're synthetic. Then we had that whole Premarin and Prempro and just basically fake estrogen and fake progesterone wave that came out where women were taking like horse urine. But there's not a lot of fake testosterone. I mean, short of getting it from the dude at the gym off the black market, there's not a lot of fake testosterone. So whenever you get testosterone prescribed to you, it's going to be bioidentical 9 times out of 10. But the bioidentical hormones that you're talking about, when you say biohormones altogether, then we can run into some issues, because sometimes progesterone can be too high and that can make you gain water. If you are on too high of a dose of estrogen, even bioidentical, that can make you gain, if it's too high for you and you're not really low estrogen. So there's so many, I could go on. That's a whole nother podcast, J-Ro. That's a whole nother podcast about taking bioidentical hormones and making you gain weight. We would have to deep dive into that a little bit further. All right. Awesome. Can't wait. Very excited. Love you guys. Love you guys for jumping on. What day of the menstrual cycle is best to test for T? We answered that. Doesn't matter. A couple more questions here. Thank you all for jumping on too, by the way. Jennifer, I answered that. SHBG binds to testosterone. So things you can do for high sex hormone binding globulin: hot yoga, infrared saunas, meditation, lowering your stress, making sure that your vitamin D is optimal, like 80 to 100 optimal, making sure you're taking zinc every day, taking larger amounts of vitamin C, like going up in the grams, maybe not just like one little capsule of vitamin C, but trying to get in 3, 4, or 5 grams of vitamin C. All of that will help to lower your sex hormone binding globulin. Okay. What do you recommend if you've been supplementing with testosterone for a couple of years and you're now dealing with chin hairs? It's the like weighing. It's the do you want sexy muscle and fat loss and protection against autoimmunity and a sex drive and a good mood, and maybe get a little bit of laser hair removal, which is dirt cheap these days, especially for the chin? I got to put that on my list of things to do. Even though there's a couple dark, again, men, earmuffs, even though there's a couple dark hairs, you know, I still don't want them. You don't want to be plucking them all the time. And then did you ever do the thing, ladies, where you get close to the mirror and you're like, oh my God, why didn't somebody tell me that I have like a 1/2 inch long dark hair coming out of my face? So anyways, Natalie, yeah, you want to get some laser hair removal? Because I'll tell you what, I would rather do that than walk around with no facial hair, but I'm fat, I have no muscle, and I'm in a bad mood. Oh, and I don't want to have sex. I'll take the higher testosterone. and my tweezers or some laser versus the other way around. All right, last one. I got to jump off. Last one. Facebook user. Mine is less than 3. When looking over my blood work, less than 3, girl, man. When looking over my blood work, my PCP said, you are fine. You're a female and don't need testosterone, and moved on to the next thing. Oh, goodness. No, I got you. Yeah, I don't know. I think that says it all, doesn't it? Like, I don't even have to reply to that, do I? That just says it all. So here we are back in conventional medicine. You're fine. You're fine. You don't need testosterone. You're female. Yeah, doc, if you open a medical textbook, you'll see that there's this section called sex hormones. And in that section, under females, you're actually going to see testosterone in there. Yeah, it's a thing. It's a thing. Oh, girl, just run far, far, far away from that doctor. Far away. All right, I'll squeeze in one more just because I'm a sucker for questions. I have Hashimoto's thyroiditis, can't get antibodies down, just tested and have low testosterone at 24, TSH 4.96, haven't cycled for the last 5 months. So this is a loaded question. Number one, if you have Hashimoto's, you have to get optimized. With a 4.96, you are in a hypothyroid state. So if you're just testing TSH, you got to test free T3, free T4, reverse T3. And those have to be optimized. I don't know what medication you're on or what dose. If your testosterone is at 24, yes, you want to get that up. Don't hang your hat on the antibodies. That doesn't dictate how you're doing, but your actual thyroid hormone levels do. So when you look at that free T3 and you look at that free T4, that's going to tell you whether or not you have enough thyroid hormone in your body. And that is going to dictate whether or not you are cycling, whether you feel good, decrease in symptoms. I mean, you're not cycling for the last 5 months. I don't know. I mean, there's so many factors, Susan. I don't know your age. Again, I don't know how your thyroid is. I don't know if you're optimized. I don't know your dose. Are they testing your progesterone? Are they testing your estrogen? What's your age? Are you postmenopausal? Are you headed into that where your hormones are starting to fluctuate? That's okay. We can replace those hormones. And there's some other factors going on right now where we are seeing the reproductive system get hit as well. Certain medications. So it could be a culmination of all of those things. It's hard to say, but I think you have a discovery call scheduled. So hopefully you do, so we can take care of that. All right, you guys, I love your questions. I love your questions. So, okay. Thank you so much for jumping in. And this will be a podcast tomorrow on the Thyroid Fixer podcast. If you are not subscribed to that, please do so. And as always, I will see you guys next week.